The committee will come to order. I want to thank everyone for being here today. The American economy is soaring. Significant growth is occurring as we speak, and Americans, especially entrepreneurs, are once again optimistic about the future of their businesses. Just 2 days ago, the National Federation of Independent Business Small Business Optimism Index soared a new record high in the survey's 45-year history, showing that small businesses are finally feeling confident and are ready and willing to execute plans to grow their businesses. However, many small businesses are now facing a new challenge in finding, hiring, and retaining qualified workers. The NFIB also noted that 62% of small businesses reported trying to hire, to hire new employees, with 89% of those businesses reporting finding few or no qualified applicants. A record 25% of small businesses cited the difficulty of finding qualified workers as their single biggest problem, up 2 points from just last month. Today, we are here to examine why that might be. In recent Small Business Committee hearings, we have heard reports about how the opioid epidemic is impacting small businesses across this nation. Driven by the rise in opioid prescriptions and the influx of illegal opioid drugs into communities, drug addiction has grown in the United States in recent years. The opioid epidemic touches families and communities all across this country, so much so, in fact, that President Trump declared the epidemic a public health emergency almost 1 year ago today. We have seen that the opioid crisis has the ability to impact businesses, too. Many young working-age Americans are not working or actively seeking work as a result of opioid addiction, impeding the ability of businesses to fill important job openings. In 2015, an estimated 2 million workers were not in the labor force due to the opioid epidemic. According to a recent report by the National Safety Council, more than 70% of United States employers have been affected by employees' prescription drug use. We want to hear from our witnesses today, and we appreciate that they've taken time away from, I'm sure, important obligations that they have here in their business schedules to share their expertise with us on this very important topic, and we look forward to having a very productive discussion here this morning. So we want to thank you for being here, and I would now like to recognize the ranking member, Ms. Velasquez, for her opening statement.
Thank you, Mr. Chairman. America's economy has improved since the Great Recession, and unemployment is at an 18-year low. But while most signs of economic gains are promising, the labor participation rate has been on a decades-long decline. As in previous hearings, we have heard what a challenge the workforce decline has had on small firms all over the country. With low unemployment rates, small employers are reporting difficulty finding qualified and skilled workers. Analyzing the United States workforce reveals two areas of concern: an existing skills gap among workers and a shrinking workforce. These problems are magnified by the opioid crisis. More than 2 million people struggle with opioid addiction, which is now one of the deadliest public health crises in modern history. This epidemic is not only wreaking havoc on our communities, but also ravaging our workforce. In the last 15 years, over 20% of the decrease in labor participation can be attributed to the increase in opioid prescriptions. For businesses, this reality has real consequences. If we are unable to meet the demand for trained workers, it will weaken our ability to compete globally. For individuals, this reality has even more devastating consequences. In 2016, opioid overdoses killed more than 42,000 Americans, more than car crashes and guns combined. And those addicted to opioids are 3 times less likely to have completed post-secondary education, adding an additional barrier to re-entering the workforce. This epidemic begs the question of how We address the skill gap to get qualified people back into the workforce to fill these jobs. It is critical to re-engage adults who have left the labor force due to opioid addiction. Access to treatment must be widely available, from drug rehab and medical interventions to non-addictive alternatives to pain management. According to NIH, the most successful addiction treatment programs teach coping skills, mobilize community forces, and instill values toward pro-social behavior, such as meaningful jobs. Such efforts are a critical part of today's discussion for both economic and addiction recovery. Too many American workers have been left behind because of addiction, to the detriment of small firms and entire families. To assemble the workforce that American businesses need to thrive, policymakers, educators, and businesses need to collaborate to find a solution to the opioid epidemic. I look forward to today's hearing, and I thank the witnesses for being here today. Thank you, Mr. Chairman. I yield back the balance of my time.
Thank you very much. Gentlelady yields back. And before I introduce our witnesses and go into our timing rules, I'd like to recognize we have a new member of our committee, Troy Balderson, who's from the great state of Ohio, which happens to be my state. He came to Congress replacing Pat Tiberi, and prior to that, that district had been held by John Kasich, who's the current governor of Ohio. Troy was sworn in just last week. We're delighted that he was selected for the Small Business Committee, the most important committee in the House. And his experience as a state senator and as being involved in two family-owned businesses it will be a great asset to this committee, so we welcome him here. And if committee members have an opening statement prepared, I ask that they be submitted for the record without objection so ordered. And I'll take just a moment to explain our timing rules. They're pretty simple. You get 5 minutes. And there's a lighting system to assist you. The green light will be on for 4 minutes. The yellow light will come on, let you know you got a minute to wrap up, and then the red light will come on, and we'd ask that you try to end your statement at that time. If you need a little time to wrap up, that's okay. And I would now like to introduce the witnesses, and we'll begin with our first witness, Mr. Ben Gittes, who is the Director of Labor Market Policy at the American Action Forum. He has written extensively about the opioid crisis, and his work has been referenced by news publications such as the Wall Street Journal, the Washington Post, and many others. We thank you for being here today. Our second witness will be Ms. Katie Van Dyke, who is the Director of the Ohio Small Business Development Center, or SBDC, at Cleveland State University in Cleveland, Ohio. In this role, Ms. Van Dyke works to provide free training and advice to startups and entrepreneurs and existing businesses seeking to scale and grow, and we thank you for being here. And I would now like to yield to the ranking member for introducing our third and final witness. Thank you.
Thank you, Mr. Chairman. It's my pleasure to introduce Ms. Lisa Allen, President and CEO of Zingenfelder Company, a privately held, family-owned business in West Virginia. Her company manufactures and sells budget-saver popsicles. In the past 10 years, the company has grown from 75 employees to over 300 across 3 locations. Ms. Allen has been widely recognized for her compassionate hiring practices and dedication to her local communities. Welcome, Ms. Allen. Thank you for being here.
Thank you very much, and we welcome you. And Mr. Gittes, you're recognized for 5 minutes.
Chairman Shabbat, Ranking Member Velasquez, I'm pleased to be here. A few months ago, I was in Boston for an opioid event, and there was a construction business owner who told us the story where he was at a job fair, and he told a room full of people, if you can pass a drug test, you have a job. Half the room left. We've heard stories like these from small business owners countless times, and it's made me interested in gauging just how many workers could be out of the labor force due to opioid dependency. And so my work at the American Action Forum has focused on 3 main areas. First, I just wanted to identify what is the source of this crisis and why are overdose fatalities rising. And I found that from 1999 to 2010, prescription opioids were really the source of rising dependency and in rising overdose fatalities. The supply of prescription opioids grew, and along with it was a growth in prescription opioid-involved overdoses. But in 2010, there was a pretty major shift, and in response to several policy and private sector initiatives, the supply of prescription opioids peaked and then began to decline. Along with it, overdose fatalities caused by those drugs flatlined, but overdose fatalities caused by illegal drugs like heroin and illegal synthetic opioids both spiked. And that's why today we're seeing an acceleration in the total number of opioid overdose fatalities. Second, my research has quantified the number of workers nationwide who are out of the labor force and what that means for the U.S. economy. I estimate that between 1999 and 2015, the prime age labor force participation rate, that's people 25 to 54, that rate declined by 1.6 percentage points. That means that in 2015, 2 million workers were absent from the labor force due to opioids. It also means that the economy, it was a major drag on U.S. economic growth. The figure suggests that during that time period, the U.S. economy lost out on $1.6 trillion in real economic output. In other words, had these workers been in the labor force, the economy would have grown about 30% faster. The research also indicates that female workers left the labor force slightly more frequently than male workers due to opioids. And it also suggests that small businesses were particularly heavily impacted by this crisis. The third point that my research is focused on is estimating just how many workers are out of the labor force and what's the impact on the economy in every state due to the opioid crisis. And I found that the impact varies considerably by state. The two states that are by far the most severely impacted by this crisis are West Virginia and Arkansas. Their prime age labor force participation rates fell by 3.8 percentage points due to opioids. To put that in perspective, remember that the nationwide decline was 1.6 percentage points. So it's pretty clear that these states are being ravaged by the crisis. Other states that are being negatively affected are Missouri, Kentucky, and then if you look at the states across the country, the states that tend to be more negatively affected are located in the Southeast and the Midwest. So you have states like Ohio, where the participation rate declined by 2 percentage points, and also Louisiana, Tennessee are seeing a pretty negative effect. And I should also mention that New York also experienced a pretty significant decline in labor force participation, about 3 percentage points due to opioids. Now, I have a lot of data on a lot of states, but I'll leave it there, and I'm happy to answer any questions you have. Thank you.
Thank you very much. Ms. Van Dyke, you're recognized for 5 minutes.
Thank you, Mr. Chairman, Ranking Member Velasquez, and members of the committee. It is an honor to be here to speak with you today about how the opioid epidemic affects small businesses. I'm Katie Van Dyke, Director of the Ohio Small Business Development Center at Cleveland State University. I'm proud of the work that we at the Small Business Development Centers do to support our local small businesses, who are the critical components and major contributors to the strength of our local economies. The Small Business Development Center program provides assistance to small businesses and aspiring entrepreneurs through no-cost business advising around business plan development, financial packaging, lending assistance, exporting, and market research. The SBDC program is made possible through a collaborative partnership between our congressional champions, the Small Business Administration, and state hosts. Last year alone, the Ohio SBDC program helped 722 entrepreneurs start their business. We worked with existing businesses owners to access $230 million in capital. Our clients created or retained nearly 14,000 jobs, and we worked with more than 500 companies to increase export sales by $99 million. But a significant challenge to Ohio's current business operations in both the urban and rural communities is Ohio's opioid crisis. Here are the statistics, which is a snapshot of Ohio. In Ohio, from 2016 to 2017, overdose deaths due to opioids increased 39%, and Ohio was the third largest increase among the states. 14 people a day die of an opioid addiction. These deaths aren't the stereotypical junkie on the street. They are people involved in the community, your average American workforce age. 68% of Ohio's injured workers were prescribed narcotics in 2016. Unintentional drug overdoses and addictions that may have started as a single prescription from a surgery or an injury cost an average of $5.4 million each day in medical and work loss costs in Ohio. Over 2,500 employment age between ages 25 and 64 in Ohio died of an opioid overdose in 2017 alone. Half of Ohio businesses reported suffering consequences due to substance abuse, including absenteeism and decreased productivity of their employees, and a shortage of workers who can pass drug tests. Here are some more staggering statistics according to the Alcohol, Drug, and Mental Health Services Board. 2/3 of those abusing prescription medication are doing so while on company's payroll time. 9% of full-time employees are abusing drugs, while nearly 14% of part-time employees are abusing drugs. 44% sold drugs to other employees. 64% admitted that drugs affected their performance, and 18% stole from coworkers to support their habits. 1 in 3 businesses do not administer any components of a drug-free workplace program. There are many small businesses who are wondering just how to deal with the opioid crisis. It goes beyond the addicted employee or the shortage of applicants that can pass a drug test. Opioid addiction is affecting employees and their families. This is happening everywhere. This is a problem all businesses are facing or will face in the near future at the rate that we are going in Ohio. Thankfully, there are many great resources that are on the ground working to educate employers and employees alike. But there is a lot of work to do. Getting the information out quickly and reaching the small business owner is a challenge we face. The Ohio SBDC at Lakeland Community College created a workshop called The Opioid Crisis in the Workplace, the proactive role employers can take. This workshop was built to be easily replicable for each SBDC in the different counties to offer and customize with local subject matter experts. We are also partnering with our local chamber to hold this workshop in Cuyahoga County in October, and we can offer continuing education credit to HR professionals that attend. We are also working to share the resources from partners that are available to small businesses when we advise them. There is a drug-free workplace training program offered by the Ohio Bureau of Workers' Compensation, and Ohio Chamber of Commerce collaborated with working partners in Anthem to develop a free opioid toolkit containing webinars for employers and employees and customizable printable resources for use in the workplace. The most important thing we as a community can do is to get everyone to talk about the facts, the staggering statistics, and break down the stigma that this is someone else's problem. It affects us all, whether directly or indirectly. As business advisors, if we can face this problem with as much knowledge as possible, we will be better armed for changing the statistics and creating a healthier workforce.
Thank you very much. Ms. Allen, you're recognized for 5 minutes.
Good morning, Chairman Chabot and members of the Small Business Committee. Thank you for the opportunity to testify before you to discuss the opioid epidemic and to share our culture and our solutions for change in our business and in our communities. I hope that by sharing our story, we can make a dent in this terrible drug epidemic. My name is Lisa Allen, and I am the president and CEO of the Ziegenfelder Company, a privately held, family-owned business located in Wheeling, West Virginia. We make people smile with really cool treats, manufacturing Budget Saver Twin Pops and other frozen items. Since 2003, Ziegenfelder has averaged 12% year-over-year growth in a grocery category that has been flat to declining, making Budget Saver products the market disruptor. With 3 manufacturing facilities in West Virginia, California, and Colorado operating continuously, our Budget Saver products can be found in grocery stores in nearly every community across the country. Last year, we proudly sold over 40 million bags of Pops into homes in America. While we are proud of this growth, the source of my pride comes from our team we call a tribe. We are individuals, families, and a community linked by our culture, our practices, and our vivid vision. All members of our Ziggy tribe benefit from our committed, compassionate hiring practices. Our doors are open to nearly anyone who is willing to work hard, grow and develop, and can commit to our Ziggy essentials. Perhaps our hiring practices emerged from our culture and our commitment to our tribe. Yet we intentionally refocused our hiring practices from the harsh reality of our shrinking workforce caused by the devastating effects of drug addiction, which knows no bounds. Addicts are our sons, our daughters, our mothers, our fathers, and our friends. Diversity of potential, talent, and intellect are interrupted and hijacked by drug addiction. Yet with hope, recovery, and connections, a person's resilient spirit can rise again. At Ziegenfelder, we offer a safe environment where tribe members have a place to recover and prosper. We feel validated when our employees are in trouble. They look inward to each other and to our leaders and ask for help. When our tribe is hurting, we are hurting too. We take an active role in developing connections with people in our tribe, demonstrating our care for each person. Intentionally connecting, asking about their lives, and building relationships with people who feel isolation or have lost connections can make the difference in addiction, relapse, and reincarceration. Just this last Saturday, I subtly honored one person celebrating 3 years clean and another who had their ankle bracelet removed with a hug and a high five. Hugely meaningful milestones in recovering in their changing lives. In our Ziggy tribe, loosely structured peer groups have emerged addressing issues they surface and work together to solve. We work with social service agencies, our medical community, law enforcement, parole and probation officers on a case-by-case basis, working to employ and assist recovery and reentry. We have visited state and federal prisons. We've participated in job fairs inside jails, reentry simulations, and in partnership with the West Virginia Department of Corrections and Rehabilitation, members of our tribe have become certified addict recovery coaches. We work closely with the halfway houses in Denver, Colorado. We're working with the West Virginia Department of Corrections on a pilot work release project with our Northern Regional Jail. Currently incarcerated men with excellent conduct records at the tail end of their sentences walk 3 blocks to our facility, work an 8-hour shift, and walk back to the jail. A win-win. While we are compassionate and have open hearts, we are not foolish. We have customers and a business to run. We are grateful that most of our tribe is also committed to protecting our business and each other. We are a close-knit, trusting community, and people look out for each other. Inclusion is our strength and our competitive advantage. Standing idle, often in judgment of others, doing little but measuring and analyzing statistics, does not erase mistakes nor change the spiraling impact of addiction. Even worse, it may perpetuate crime and other debilitating problems. We believe a job and connections are the best antidote. And this belief has been affirmed over and again by our tribe members. The drug epidemic is devastating, yet we believe in the resiliency of the human spirit. It takes courage to stand up and make change. It takes courage to believe, and it requires courage to take the first step. We will continue to embrace the opportunity to demonstrate and reward this courage. Our results are not without failures. This is messy, and unfortunately, we have many failures. However, we learn from those disappointing circumstances, and we know the next person deserves our open hearts just as much as the last. I'm proud of our tribe. Drug addiction and associated social problems know no bounds. We are working to combat this enemy one person, one family at a time. We know to each person that we touch and we can help, we make a difference. Thank you for this opportunity to share our story, and I look forward to your questions.
Thank you very much, and I'll recognize myself to begin the questioning for 5 minutes. And Mr. Gittes, I'll begin with you. You had mentioned in your testimony that you felt that small businesses were particularly affected as opposed to larger companies by this opioid addiction. Why is that, and how is that affecting small businesses across this country?
So small businesses, by the sheer quantity of them, a lot of workers are employed by small businesses. So just on that basis alone, they'll be negatively affected by this crisis. A rough estimate suggests that about 45% of these absent workers, or about 900,000 of them, would have been employed by a business with under 50 workers. And it's also important to keep in mind that small businesses have fewer resources in terms of attracting employees, so they have to rely on things like job fairs and all that, and so that would also be difficult for them.
Thank you. Ms. Van Dyke, I'll go to you next. If a client comes to the Ohio SBDC and has a problem with opioids in the workplace, could you walk us through the steps that you would take in trying to help them?
Sure. My biggest role in that situation would be to connect them with the resources available. Unfortunately, small businesses do not have a lot of resources for maybe an in-house HR, but there are quite a few resources in Ohio. For example, Working Partners is a consulting firm that would help them, and the Ohio Bureau of Workers' Compensation could help them to implement a drug-free workplace. Maybe not at that point, but we could also educate them and educate the other employees. We'd also need to walk them through understanding, possibly helping that employee to get into rehab and offering them a second chance based on getting clearance from a counselor and going through some rehab and recovery.
Okay. Thank you very much. Ms. Allen, I'll go to you next. Your story and your commitment to your community is very inspiring. What are the most rewarding and most challenging parts of hiring recovering addicts and others reentering our community?
Well, thank you for your question. Rewarding, it's seeing success. It's watching people who feel like they have no hope, came from a bad situation or reentering and have no home to go to. Finding a home with us, finding a work home with us, the opportunity to earn an income and to make connections. Fortunately, just by chance, my office is just outside of my office is the time clock for our business. And so I get to see our folks every single day, and I can have conversations and build relationships. That's incredibly rewarding, and I think it gives people the connection that they need, that they don't have. The most difficult is knowing that somebody didn't come back to work, didn't show back up to work, to know that we've lost the life of past coworkers due to this addiction. That's the hardest part, but we plug through.
Okay. Thank you.
You're welcome.
Would anybody like to cover any concerns that companies might have, liability issues, if they're hiring folks who may have struggled in the past and have been facing challenges of addiction? Ms. Van Dyke, would you like to talk about that?
Sure. As a small business owner, you like I said before, you have limited funds to spend on an HR or HR policies, but there are, like I said, free resources out there so that you can develop programs so that when you are bringing someone on board that maybe has some previous history with drug abuse or drug addiction, that you can put them into a program and know that all of your employees are educated, and they're also affecting their employees or their families by bringing that education home and talking to their kids and learning more about the addiction and possible who of your employees could be more addicted than others. It's also about not only educating your employees, but having, like I said, the policies in place, things that are going to protect you as a business so that there are no liability issues. If an employee does injure someone because of the addictions, they come to work addicted, maybe they're high or something and they have an accident at work, knowing how to deal with that in a legal, and having your HR policies is really important.
Thank you very much. My time's about to expire, so I'll turn to the gentleman from Florida, Mr. Lawson, who's the ranking member of the Subcommittee on Health and Technology, for 5 minutes.
Thank you, Mr. Chairman. And this question will be to everyone on the committee. How can the federal government provide support to small business who hire those recovering from addiction, and what other resources exist for those companies outside of the government? And I would like to have all of you all to respond to it.
I'm not sure what is available for small businesses in order to help their employees treat addiction. I'm not an expert on health issues, and that's sort of more focused on the workers themselves. But that's something I can look into.
Well, from the standpoint of federal government, you have no recommendations?
Well, just in general, overall, there needs to be a more comprehensive approach than what has been employed so far. In around 2010, there was just a focus on prescription opioids, and now we have accelerating overdose deaths with other types of drugs. And so there needs to be more focus on treating actual addiction and also addressing the unlawful drugs like illegal synthetic opioids and heroin.
Okay, Ms. Van Dyke.
There are many things the government can do, especially focusing on spreading the word. Small businesses sometimes have a hard time approaching or asking for help. So getting, just supporting the education and getting the word out there and talking about the issues is very helpful. Having easy access to resources is very helpful for small businesses so that they can begin to understand the addiction and education around it and get it out there to their employees.
Okay, Ms. Allen.
So my answer might be a little bit different. I think as a small business owner, I think small businesses are, for us speaking specifically, I would much rather the federal government, rather than support us. I think that the problem is so pervasive that I would rather whatever money you would be interested in giving us, put into education, into the education system, and into mental health issues, because addiction is an outcome to me in a lot of cases. Addiction is the result of isolation, of mental health issues, of lack of education, a lack of connections, a lack of the humanness that needs to exist in our world. So I think our education system is a great place to start. And then more emphasis on another great place in the corrections system, preparing people who are leaving the Department of Corrections so that they know how to get out, and when they get out, what to do, where to go, how to get a job, how to hold a job, all those kinds of things.
Okay, and it's obvious that from what you stated, do you find any help that comes from SBA?
We don't specifically know.
You don't specifically know. Do any of you all know whether SBA provide any educational opportunities for small businesses besides just applying for a loan or something of this nature?
I can answer that. We're powered by the SBA. Basically, our funding provides us to provide free technical support. So we feel like we're the soldiers on the ground because of our SBA grant. So we're out here as small business advisors, working with small businesses and finding those resources for them to make their lives a little easier, because there are quite a few resources for small businesses. It's just that we have a hard time marketing, obviously, from our funding. We're focused on working.
So with a few seconds I have left, do you think there'll need to be more emphasis from SBA to small businesses, educational emphasis on how to help small businesses with this crisis?
It should be an initiative for sure.
Okay. Mr. Chairman, I yield back.
The gentleman yields back. Thank you very much. The gentleman from California, Mr. Knight, who is the chairman of Subcommittee on Contracting and Workforce, recognized 5 minutes.
Thank you, Mr. Chairman. This is a good hearing. I wish we didn't have to have this hearing, but it's a good hearing to see what's happening in America. In my district, we have a lot of aerospace, and the number one thing is when you get your DoD clearance, obviously you can't have any drug addictions, use, or anything. Living in California, we have new laws and new things that are going on out there that are different. And I can probably always say that, but they are making it so that some of our young folks think that it's okay to do a certain drug, and then they can get their clearance. Obviously, that can't happen. So we're trying to educate young folks. We're also having a problem, especially in my district and others in Southern California, to find people that can pass a drug test to to just show up for work. And that is one of the biggest issues when we go out on a job fair or something like that. Is the first thing is we want you to pass a drug test for certain jobs. And so my questions are more in line with that, and Ms. Allen, I liked your testimony, and I liked the way that you framed it. We want to help people, and we want to give them a chance, and if they take that chance, then great. If they don't, we also know we've got to run a business. We've got to make sure the business makes money for all the people that are employed here, and it continues on. So if you take advantage of that chance, then great. So I'd like to hear some of the kind of the story, not the stories, but tell me what you have done when you have found somebody that has come in to work and now you have found that they haven't exactly followed the rules. What is the process there?
Well, thank you, Mr. Knight, for your question. The process is typically, those things surface for us, as I stated, the kind of ad hoc peer groups that have developed, the people helping people, they surface, the information surfaces, it works its way through our organization, typically gets quickly to our plant management and our HR department, and if the person's willing and interested in assistance, we work with our social service agencies, we work with counselors. Sometimes once it comes up, they just disappear, they don't come back. That happens a lot, unfortunately. But there's connections. We're in a small community. We're in Little Wheeling, West Virginia. We have a population that's, 25, 35,000 people. And so a lot of people know each other, and so the connections are there. Typically.
And you might be the biggest employer.
Pardon me?
You might be the biggest employer. Is that close?
Well, we're not, because we have two other facilities. But we are a large employer in the community, about 150 people locally. And people connect, so we rehire as well. So if somebody leaves, disappears, we don't know where they are for a few weeks, and then they come back and they share their story, and we talk, and we don't drug test on the front end anymore. What we do, though, is we've done a lot of training on reasonable suspicion, and so we know what to look for. We know signs to look for, and we pay attention, and there's word amongst our tribe. So we kind of self-regulate.
So it's interesting to hear business owners talk about trying to help people with a drug addiction and what you do and what you can't do. Obviously, if somebody came in and they were working for me and I caught them stealing something, I'd fire them right there. With a drug addiction, you can hear, and I hear this from businesses all the time, we're trying to help you. You've got to help yourself. So if you leave for those 2 weeks, you come back and you explain what went on, and we're going to still have some compassion for you, but understand that we want you to get moving. And so there is some tough love there, too.
There has to be.
In my previous life, I was a Los Angeles police officer, and we had the DARE program. And when I started in 1990, the DARE program had been going on for 5 or 6 or 7 years or something like that, and it was very heavy into the school districts and making sure that the kids knew, if you do this, you've already put yourself in a difficult situation. So don't start. Don't think that you can just do it and then everything will be okay. You'll just not do it again. I think that we should go back to a lot of these types of programs in America, and whether they're local or they're some big Just Say No DARE program that gets kind of a universal American look at drug use. The drug use in America has been one of our greatest black eyes as it is, and we've got to figure out new and innovative ways, and I think some of these programs that infiltrate locals and go around the whole country is the way to do it. Thank you, Mr. Chairman.
Thank you
I
very
yield
much.
back.
Thank you, gentlemen's time has expired. The gentleman from Pennsylvania, Mr. Evans, who's the ranking member of the Subcommittee on Economic Growth, Tax, and Capital Access. Recognized 5 minutes.
Thank you, Mr. Chairman. Mr. Chairman, I'd like to thank you and the ranking member for just organizing this panel. It could not be more appropriate at this time. Ms. Allen, what supports have you found to be the most useful in decreasing the likelihood of relapse? What supports have you found to be the most useful in decreasing the likelihood of relapse? Okay.
connections, building relationships. People, in my experience, what we've seen and what I've heard, drug addiction creates isolation. A lot of what Mr. Knight was talking about stealing, that, the two kind of go together a lot of times. So people find themselves very isolated. They don't feel connected to anybody. So by building connections, it makes people feel important. They feel loved. They feel included. And with that, they ask themselves, I just had this conversation the other day, they ask themselves, do I want this life or do I want this life? And these people are nice to me, and they take care of me, and they care about me. I think I'll go another clean day. I'll go another clean day. And it's a flywheel. It's truly a flywheel. We find support with our counseling services in our community. We find support with the social service agencies. But I think it's really just helping people with connections and letting them know that people care about them. One of the things that I feel very strongly, and we feel very strongly in our business, is those words that haven't always been hard business terms like care and commit and compassion, and those are true leadership skills, and those are true business terms, and we use them often and frequently, and I think it helps with the connections and it helps people overcome.
As sort of a follow-up, obviously you cannot legislate connections. That's the rumor I hear. I don't know. Maybe somebody been around here longer than I can figure that one out. Then what are the conditions that sets it up to just understand what you just expressed, which I assume you learned from experiences?
Gosh, I wish I had a good answer for that. I think it's conversations like this, to be honest. I think it's conversations that recognize that this is a human issue, and people are resilient. And addicts don't want to be addicts. I mean, I've never experienced it myself, thank goodness, but I don't believe that somebody in such a miserable state is there by choice. So I think it's incumbent upon all of us to recognize the humanness of it and to help people through funding sources, through, as I said before, helping people who are leaving incarceration after whatever their length of term was. Most of them, a lot of them, the ones I've experienced, really do want to change. Really do want to change. I spoke about the work release program we have with our local jail. We have one gentleman, I just learned yesterday or the day before, I approached him and he told me that he has 2 bachelor's degrees and a master's degree in chemical engineering. And he's a pretty good mechanic too. And he gets out soon and he likes his job. So they're no different than you and I, other than they made a bad choice, a lot of bad choices. But they're human and they're intelligent and they have value and they're labeled for life. And I don't know that that's necessarily fair.
Mr. Chairman, I wonder if with Ms. Van Dyke, can I get a question in? Or?
Sure, yeah, you got time.
You discuss efforts that the SBDC is taking to assist employers who are struggling with employees impacted by the opium crisis. What, if any, supports are you providing to assist in filling the skill gap problem that small businesses have become of the opium epidemic?
Thank you for your question, Mr. Evans. That's a tough one. We rely heavily on Ohio Means Jobs. They have a wonderful, massive database full of employees seeking jobs. So when our small businesses are looking for employees, we work with Ohio Means Jobs to help them kind of sift through the database of people looking. But again, I think it just goes back to education around our small businesses and what they are looking for in skills versus what's available.
And the gentleman's, thank you. The gentleman's time now has expired. The gentleman from Kansas, Dr. Marshall, is recognized for 5 minutes.
Okay, thank you, Mr. Chairman. Maybe I want to focus on prevention for a second and see if you all have any suggestions. I'm a physician myself. It's said that 80% of people on opioid addiction problems started off with a legal physician prescription. I think that number is pretty high, but I'm going to assume it's right. So across my district, I'm seeing clinics, physicians develop protocols, how to handle chronic pain. That kind of keeps some of the patients from doctor shopping, bouncing around. And then next, we're developing protocols how to handle acute pain, post-operative pain, those types of things. Are you all seeing that happening in any of your home states? Doctors are taking responsibility to do this. Ms. Van Dyke, are you seeing some of that?
Yes, and I'm not a medical official at all, but in Ohio, I know we use the ORS system, which a doctor can get information on previous prescriptions and other things for each client that they have, so that they're better understanding what they have been taking and who they've been seeing. I think that's very helpful. And I think that the changes in the medical community and the knowledge that they have of the addictions that are happening because of the prescriptions is definitely really impacting and lessening the opioid prescriptions that are just going out to everybody. It's definitely made a difference in Ohio.
Okay. Mr. Geddes, you seeing anything happening, improving in that area?
Yeah, you can see it in the data, how changing behaviors and also in response to changing attitudes and policies, the supply of prescription opioids in the United States has been declining each year since 2010, and it's by about 5% rate. And so that's good news, and I think it would help limit the number of folks who are exposed to opioids in the first place. The tricky part is addressing those who are already addicted and those who are using the illegal substances.
Okay. Is there anything else that you all can think? Whether it would require, I don't care whether, I actually would prefer staying away from the federal government dictating new rules. What else can the medical folks do that they're not doing now to decrease the number of people becoming addicted to narcotics? Are you seeing any better practices out there? Anything else that you're seeing? Go ahead, Ms. Allen.
I can only speak from personal family experience that it appears that it's well regulated and well controlled, so that possibly, obviously it doesn't create addiction or cause addiction. I think in our family case, you can see the process working. I think what's happening though is it's to Mr. Giddis's point. It's not the prescription opioids anymore. It's the synthetics that are on the street. It's the synthetics are on the street that are causing the greatest devastation at this point. I can't speak to that statistically, but that's what I feel.
Yeah, I think that's absolutely right. Fentanyl is the big synthetic drug that China is making, shipping over by our U.S. Postal Service, and for some reason our U.S. Postal Service doesn't know where the package is coming from. And one of the things we've recently done is pass legislation to hold them accountable as well. And people just don't realize how powerful fentanyl is, 50 times, 100 times stronger, and that's why most of the people are dying. They're used to taking 5 or 10 Percocets to get high, and you take 5 fentanyls and you're done. It's so strong that a drug dog walking by it, sniffing it, can kill the dog itself. So I think we're all becoming more and more aware of that as well. I guess we'll spend the last minute on treatment plans. What's the most effective thing that you're seeing? Ms. Allen already mentioned relationships, having relationships. We're funding telemedicine more. We certainly do think mental health is a big culprit here. I think we're doing more in this Congress to reorganize mental health than since John F. Kennedy. So I'm proud of that. Do you guys see any other things, success, what's working? Ms. Van Dyke, what do you think is working?
Sure. I think on the small business side of things, getting small businesses to understand that you don't have to fire that person that has the addiction problem. If they go through proper rehab through a credited source and they work with a counselor, they are less likely to use again, and you don't have to retrain them. You can bring them back once they've had, been cleared through a counselor, and they're ready to go again. And giving second chances and helping small businesses to understand that giving second chances to people is the way to go, for the most part.
All right. I think my time has expired. I yield back. Thank you.
Thank you very much. Gentleman's time has expired. The gentleman from Ohio, Mr. Balderson, it gives me great pleasure to yield 5 minutes to you if you'd like to ask questions. And don't screw it up.
Mr. Chairman, thank you very much. I really don't have any questions. I will comment on what Mrs. Van Dyke says and some of the things that we've done in the state of Ohio. And Mrs. Allen is only approximately about 45 minutes away from my home county also, so down in Wheeling, West Virginia. But, you know, just mostly what Ms. Van Dyke said about what we've done in the state legislature and since 2009 with the OR system and many things. So, and I think, you know, we need to continue doing that. As far as relationships that Mrs. Allen said is something that we don't talk about and communicating with our employees and the importance of that and to help them. I mean, employers want their employees to be successful because if they're successful, the business is successful also. So those relationships and communicating with those employees and getting them the help that they need, I think is vital, and you know that's what makes it all work. So I look forward, and I'm glad to be honored to sit on this panel and hear this. I think it was very interesting this morning. So thank you all very much for being here.
Thank you very much. Gentleman yields back, and again, we welcome him to the committee, and I want to thank our panel here this morning for your testimony. I think it's been very helpful to all the members that were here and sharing your valuable insights. The opioid crisis is affecting communities really in every corner of our nation. It's clear that this epidemic is a monumental problem, but our witnesses today have demonstrated how small businesses can work with their communities to be a part of the solution. So we thank you for helping us to deal with this. The committee will use today's conversation as a way that we can continue to examine potential ways to help small businesses find the qualified workers that they need to grow their business. So again, thank you. I would ask unanimous consent that members have 5 legislative days to submit statements and supporting materials for the record without objection so ordered. And if there's no further business to come before the committee, we're adjourned. Thank you very much.